not worth stressing this cat or dog out to this point that they're alligator rolling on the floor, pooping and peeing everywhere. Let's send them home with some medication to come back for another appointment so they can be a little more chemically relaxed. Try and make it a good experience for everyone. Any other questions?
You said that you've been giving treats out for
Sorry, I didn't hear the question.
You said that you've been giving treats out to dogs more recently.
Mhm.
Is that necessarily a good thing or a bad thing?
So, do we want to give every dog, an entire bucket of treats during their visit? No. If they're already obese, which we deal with a lot of pet obesity and doing nutritional training with owners, we don't want to do excessive amount of calories in that visit, or if they're going to go get in the car and be car sick afterwards from eating so many. We do limit a little bit, so we strategically use them, maybe make the smaller pieces, make the animal work for them. And we go through a lot of easy cheese, the squeeze cheese, on like little lick-it mats, so that they kind of really have to work at it. And we don't let them eat the entire visit. We'll kind of talk, okay, we're going to work with them, so let's give them some treats, reinforce that it's a good thing that we're touching them, step back, talk a little bit, okay, we're going to give the vaccines. Let's really distract them, not only with the treats, but also with the positives. We sit there a lot of day talking the animals, oh, good boy, it's so good. And standing there and being stable for us through the vaccines. Unfortunately, tiny needles, a lot of our injections we can give underneath the skin for cat and dog versus going into the muscle, so it doesn't hurt as much, so they're pretty easily distracted for most of it. There are some dogs that we deal, or cats too, with food allergies, so we do have a variety of different types being, we've got freeze-dried beef liver, we've got freeze-dried salmon, squeezy cheese, and peanut butter are kind of the options we go through right now. And then we even have a couple cans of baby food for the ones that have real significant meat allergies, so that we're maybe using green bean or something like that instead. Everything in moderation. But gotta have something to spoil them when they come to the vet. We can definitely tell the puppies in the last few years, since we started doing a ton of treats and positive reinforcement through our puppy visits, some of them come bounding into the clinic just super happy to see us, versus some of the older dogs that are like, you're turning into the vet clinic, I'm not coming out of the car. So we do a little bit for some of the animals that are really sensitive then, and the building is a scary place. We'll come out to the car to do them. And because we do have the vehicles and go out to the farms and do the work out there, we do have the ability to do house calls. Right now, coming off of COVID, being actually down about a vet and a half from where I want to be for the practice. We don't have quite as much flexibility for that, but it gives an option for home vaccines for, say, the elderly that can't come out of their home, a dog that's too big to get into the vehicle, or we do home euthanasias as well, so that the dog can be in that relaxed home environment with everyone around and not having to have those final moments out of that clinic.
Are the drugs that you use, are they more expensive than the human side drugs? Are they similar?
So the fun is, a lot of the meds that are used on the veterinary side are actually used on the human side as well. We don't have to deal with insurance, unlike the human side where everything is put through insurance, and there's definitely increased costs with that, and then you get a bill in the mail afterwards. For us, all the costs are very much up front for the owner. We do have a markup on it to account for our DEA license, so that we can have controlled substances, to have it on the shelf in the clinic so that we can send the medications home right away. But overall, most of the meds end up being cheaper than the human side. Human side just marks it up a whole lot more than what we do.
How many people have pet insurance? Because that's a thing, so.
Pet insurance is becoming more of a thing on, especially the cat dog side. is where we think more about the pet insurance. Large animal, there is usually more of like a herd insurance for the bovine side, and then you can do individual insurance for the horses, for the higher dollar horses. The cat dog insurance, I think the statistic right now is like, I want to say it's 10% of people have insurance for their cat or dog. We don't see a ton of it around here, but it's something definitely it's becoming more aware of, especially if you have a high injury or high health risk of injury. So like our dachshunds, the long wiener dogs, notorious because of that long back of theirs, have back issues. So we'll tell people, hey, if you've got a wiener dog, maybe think about the insurance so that if it does need the back surgery, you've got that already planned for. On average, insurance policy for a cat or dog for a month, depending on what you have in it, can range from about $20 up to about $60 a month. So what I tell people if they're kind of on the fence about getting insurance is start a savings account for their cat or dog. So there's people that actually have it in the cat or dog's name. It's quite entertaining. But I tell people, okay, that 20 or 30 bucks that you would have put to the insurance and mailed to them every month, instead put that as a automatic draw and you put it in a savings account so that the money's right there if you need it for the pet. And in case of economic downturn, it's an emergency fund for yourself as well. Versus, okay, if you have an animal that, thank God, they never hurt themselves through their life, they never need that insurance coverage, but you paid them 60 bucks a month every month for 10 years, that's a big chunk of change that could have been in a savings account. So, have other purposes for it.
So have you ever done like ACL surgery on a dog?
So that we actually do not do at our clinic. We do just general soft tissue surgery. So we do more lumps, bumps, space, dentals, amputations we'll do. But the fine art of some of the orthopedic surgeries, the ACLs, pins and plates for broken bones, spinal surgery we refer out for. Fox Valley Referral Center over in Appleton is very close for us. It's only 2 hours down to get a CT MRI down at Madison. There's a couple, with some clinics expanding a little bit. There are some boarded surgeons at little clinics. So we've got one actually that's a boarded orthopedic surgeon at a clinic down in Stevens Point. So a little more cost effective versus going to the bigger cities. So it's one of those, it's fun to do some of those higher end surgeries, but it takes a lot more tools, a lot more training to make it worthwhile to do. Good questions.
We use the easy cheese on Mr. Kostreski to get him to do stuff around here too.
I do admit I use the techniques when I take my kids to the doctor. Went, okay, sit. Okay, here's your cookie. Here's the candy. Oh, they gave you a shot. Oh, here, eat the candy instead. It's all good. So the treats work on small children as well.
So if someone calls up and says, Anna, the dog's not feeling right, what's the first thing you look at? Because a human comes in, and this is about it, this is about, you know. That's your Dr. Seuss, you can't talk to it. So.
Exactly. I wish a lot of times that the animals could talk so that we could know more details. It's like that gigantic math question or a science question where you have all that extra information. You've got to pick the pieces out from the history that you get from the owner. So we started out, our receptionists are definitely our first line of defense, our first line of getting information. And we teach them that, hey, here's key things to ask, key things to be listening for, that this animal needs to be seen right now, it needs an appointment today, or okay, it's scratching its ears and shaking its head, let's schedule, a couple days out. It's not an emergency. If it's something major emergency, we tell them do not pass go straight to the emergency clinic, so that there's all hands on deck, a little more intense there. Once we get them to the clinic, then again, it's that techs and assistants taking the histories, getting as many details as they can get out of the owner. And then we come back in as the doctors and ask some of the same questions and ask that in more detail in different areas, trying to get as much information as we can from the owner. And then we start in on the physical exam, looking at the animal themselves, seeing what physical signs we have, and then maybe doing blood work, x-rays, other things that we can get as much information as we can to try and then piece together the potential, we call them differential diagnoses, but essentially what could be wrong with this animal, so that we can explain that to the owner, and then by law we have to do what's called informed consent. So basically we have to explain all the things that could potentially be wrong, our top differentials, and then X, Y, and Z different testing that we could do, diagnostics. And then, okay, if we go through those, here's what the treatment potentially could be. So it gives people the option, they kind of know, okay, is this going to be just as simple, we're just gonna hand the medication out the door, or is it something that we're gonna be in a few $100, a couple $1,000 in testing to determine the needs. So we a lot of times do get extra information from the owners that have nothing to do with it. We get told a lot about the wet and dry noses. Means nothing, but. After lunch.
Well, Nick's got this question, Nick asked me to ask you. So, when the dogs, or the animal comes in and it's not doing good, do they tend to let you work with them more than that dog just coming in for its annual shots?
It can really depend on the animal. Sometimes the ones that don't feel good, it puts them so much more on edge and they're so much more defensive, that prey versus predator instinct. Some of them, as sick as they can be, you almost have to handle them much more cautiously. Versus some of the healthy ones, yeah, you can drive them through it, we can make it a happy experience, kind of hold them still. And especially, you know, something, a hit by car, a injury, where something hurts, we have a lot of people that actually help in holding them so that we can try and feel or palpate the limbs or the body, because if we hit just the wrong spot, it's amazing how fast a dog can turn around or a cat can turn around and grab onto you. With, we'll say, smarts learned over time, we jump to medications or sedatives a little faster. Once you've been burnt or eaten too many times, it's just not worth everybody getting injured through it.
Could not rephrase the question, yeah. See, yeah.
What's the coolest thing you've done?
Ooh, coolest thing I've done. Like I said, had a lot of cool wounds. I had a horse, this was from 2 years ago, I really should put these pictures in there too. New horse hauled in from California, and 2 days after he got here, the skin on his one back leg started sloughing. And so we tracked back and we think he actually got bit by a brown blue spider in the trailer on the way. So I had about 2 months of every third day bandage changes on this poor horse. Like literally the skin just died and was rotting off of his leg. So had to sedate him very heavily, pull all that off, and that did a lot of bandage changes. So I have a huge folder of the progression of pictures of him. Infection never went in the joint. He never was lame or limping on it, and is actually back to being a show horse now. So kind of fun tracking from the beginning to end. I get to work with the deer. Especially the big farm that I now work with in Rosholt. Their cheapest price for a hunt is like $4,000. So didn't realize going into that farm that essentially they were more or less mega millions from these deer. I've gone to neuter a couple skunks, pet skunks, so they were already descented. So that's probably the most unique animal I've had to work on.
Skunks?
Yep, pet skunks. Pewter was his name. So, some odd ones to have to work with. Descented, they smell a lot like a ferret, where they've got just that little bit of musky smell to them. But very friendly. It was more or less like working with a big club cat.
So what other animals that we wouldn't think are pets have you seen? Like that's crazy, somebody has a pet skunk.
Yeah. The only really other odd ones I've worked with, I've done a little bit of work with some sugar gliders, which is kind of like a little flying squirrel. I neutered one of those for a friend. Like I've never done it, but sure, let's have at it.
Sure. Cause there's a lot of other flying gliders around that they gotta do.
Hedgehogs, guinea pigs are kind of the odds and ends, we don't do a ton with them.
Okay.
But yeah, kind of get some of those other species, it just switches up the day.
Yeah.
When I started with the practice a couple of years in, we had somebody contact us because of the craze of the potbelly pigs. And they're like, do you spay and neuter potbelly pigs? And we're like, oh, neuter the pigs on the farm, so sure, why not? So somehow I got my name put on a registry for potbelly pig veterinarians. And so we've got people that now call us from like the UP area and will drive down and spend a day in the area just so that we can spay or neuter their potbelly pig. Because nobody else will touch them. The farm vet's saying it's a potbelly pig, that's a pet, we're not taking care of just the one pig. And then the small animal side goes, that's a pig, it's a farm animal, we are small animal only, we are not touching it. So, kind of a limbo line there.
Interesting. Pet skunk.
Yeah, pet skunk is probably the coolest I've done, so.
How do you desensitize them? Is that what you just said?
Descented or deglanded.
Descented, okay.
Essentially, the breeders, because they're commercially raised, you can't just go grab a skunk from outside and take, the babies away from the mom. So they are commercially raised and vaccinated, and as tiny, like newborns, so a couple of days old, there's a little gland at the back that you essentially know of. So it's kind of like taking dew claws or a tail off.
What about the water main? There's that main farm over on the back. Do they have like a veterinarian team or just the owner?
A lot of the big commercial farms like that, you have to have a veterinarian on farm at least once a year to be able to get your medications, certain testing and certificates have to be done. But they train, either the owner knows a lot, or we see a lot on the dairy side too. A herds manager is trained in how to give the vaccines. You've got a person that comes in and is an AI technician. So we see it on the dairy side. There's maybe the vet that comes in a couple times a year for a major surgery, or just to stop in and be, all right, I've established my, called a VCPR, it's veterinary client patient relationship, that we have been on the farm, we know the animals, we've seen the cat or dog in the clinic, we know this animal enough to be able to say, yes, you can have these medications. Yeah, the big commercial, the production medicine is a whole different kind of beast. So. One more question. If anybody does want to shadow, like I said, we do take people on. Very common time is during the breaks from school or during the summer months. So if you're interested, I can leave my information.
And this clinic's right across the highway from Fleet Farm, the sign place, chapter 2, that little back street over there. So it's really close to the high school. You can walk there from here.
Just about, so.
Mr. Rich could probably throw a football from there in his glory days.
They're on Florida.
I think ways past, honestly.
What's that?
Probably ways past, honestly.
Probably.
Good. All right.